Welcome to Neurodegeneration Awareness and Artificial Intelligence. It's a podcast where we dive into the exciting world of technology and neuroscience to tackle some of the biggest health challenges of our time. I'm your host, Dr. Sukant Khurana, and today we have an incredible panel of experts joining us. I'm thrilled to have my colleagues, Dr. Brooks Robinson, Dr. Mallika, Dr. Kanis, Sohit, Kanak, Jidnyasa, Sahil, and Aditya. Some of them are established professors, leaders. Their bios will be given in the description. Some of them are young researchers, beginning PhD, just masters, BTech. It's an eclectic mix from very young people who are born into tech to people like me who have quarter of or half the hair is turning gray now. So we are covering the whole gamut from young to senior researchers to cover this field. Welcome, everyone.
Thank you, Dr. Sukant. It's a pleasure to be here discussing such a critical topic.
And also, thanks for having me, Sukant. This is actually an exciting intersection of technology and the effect of AI on human health. So it will be fun to look what we discuss.
Thank you, Dr. Sukant. I'm really happy to be here.
Thanks for the opportunity. I'm very eager to dive.
All right.
I'm trying to join the conversation and learn from everyone.
Thank you. Anyone who's not said hello to you guys who are listening out there, I'll say hello on their behalf. But we have a bunch of young students, senior experts, and we'll keep having the same team and keep adding more experts as we go along. Today, we are combining two big topics into one jam-packed episode. First, we'll explore how AI is transforming awareness of neurodegenerative diseases like Alzheimer's, Parkinson's, and ALS. Then, we'll zoom in on AI's role in personalized education for these conditions. Please understand why this is very different. People do discuss how AI is helping with blood markers or spinal tap markers. People talk of epigenetic thing. People think of picking the needle in haystack of genetic information to find this. People are also talking of AI in microbiome and neurodegeneration. There are links to fungal infections. People talk of developmental factors and their patterns and all. What we are talking is very, very unique. We are talking of AI's role in personalized education, and that sets it apart. We're also taking regions. We're starting with Middle East. There is no particular reason just to start with Middle East. We just happen to start with Middle East with Gulf Council countries. We may move to India. We'll move to USA, probably the places I love in US a lot, like Texas. I'm sure a lot of people will hate me for it. Probably not Brooks. Both of us studied at UT Austin. We will move our focus to all parts of the world as much as we can, but we are starting with one place since we had to. Let's start with big picture. Dr. Brooks, how is AI changing the game for neurodegeneration awareness globally?
Yeah, so AI really is a transformative force. It's like a multifaceted tool reshaping how we communicate about neurodegenerative diseases. For awareness, AI can power tailored campaigns. Think interactive websites, real-time chatbots, and targeted social media that can reach diverse audiences. Beyond that, it's enabling early detection by analyzing complex medical data like MRI scans. And this will help to identify disease signatures before symptoms even appear. Predictive analytics can also pinpoint at-risk populations, and virtual assistants are helping patients manage daily challenges. And online communities can foster support. It's really a holistic approach that amplifies both knowledge and action.
Well, that's a very powerful overview. Thanks, Brooks. Dr. Mallika, can you expand on how AI's early detection capabilities tie into awareness efforts?
Right. Yeah, that's a very interesting point that you bring up. AI's ability to analyze brain scans like MRIs, PET scans, and detect the subtle changes like hippocampal atrophy in Alzheimer's or dopamine transporter issues in Parkinson's is certainly revolutionary. Interesting is it can spot these years before symptoms, which is absolutely the need of the hour, pre-diagnostics even before the actual extensive degeneration sets in, which therefore shifts the narrative from despair to more of a preventive strategy. For awareness, this means that we can actually craft campaigns that emphasize proactive screening for such disorders, encouraging people to think about brain health early on. Further, AI also looks at blood tests or genetic profiles for biomarkers, further giving us a fuller picture to share with the general public and also letting everybody know about what's actually possible in the full gamut.
That's really a great point about shifting the narrative. It actually changes the whole picture from last minute emergency to being aware to managing. Malika, how do practical tools like virtual assistants and online communities fit into this awareness puzzle?
Yeah, so another great question. Sukant, actually, they are game changers. Like if you take an example, like a Parkinson's patient struggling with medication schedules, they cannot manage when to take the medicine and, other things like that. So AI-powered virtual assistants can send reminders to them, suggest doctor visits, or offer tips for managing tremors, therefore making the daily life easier. For communities, AI builds online spaces where or offers tips where patients and caregivers can connect, which is very important. Even we ignore the caregivers, like how do they manage? So imagine a caregiver posting about the ALS, which is amyotrophic lateral sclerosis, the mobility challenges. AI can actually link them with others who have faced similar issues, fostering a sense of belonging henceforth. These tools, therefore, will humanize the technology which is already there, making the awareness more accessible, understandable, that is tangible and supportive.
Thanks, Malika. I think you made a very important point. Right now, the whole world is going through AI panic. Understanding how AI can actually humanize the technology is a very unique and important point. I love how all of this we have discussed that grounds the tech into human experience. Let's move on to Dr. Kanis Fatima. Kanis, what's your take on how AI is personalizing education about neurodegenerative diseases?
I think one of the biggest strength of AI is its adaptability. It meets learner where they are, analyze their pace and preferences, and deliver the customized content. For instance, if we talk about healthcare professional, it offers advanced simulations like managing rare condition such as progressive nuclear palsy. And for patient and family, it starts with simple key fact about Alzheimer, and then it gets deeper inside over time. And for public, let's say it offer engaging and myth busting content that clarifies misconception. For example, one of the commonest misconception about Alzheimer is that it's a part of normal aging, or it only occur in elderly individuals.
That's really important point, Kanis, what you said. And I think what you mentioned sort of ties into the next point, that is customization. Customization is a key. Sohit, can you dive into how adaptive learning platforms can make customization possible?
Yeah, absolutely, Dr. Sukant. I feel like these platforms are like AI-powered tutors. They use machine learning to track interactions, user interactions specifically, like time spent on topics, quiz responses, and even adjust content dynamically. For example, if a medical student struggles with amyloid plaques, the platform might simplify or add visuals for that. And for a caregiver, it could focus on practical dementia care tips. It's about keeping the learning engaging, but not overwhelming as well, ensuring it sticks.
Well, so that was a very important point. I have seen with a lot of my friends in medical school, they're just bombarded with so much information that after MBBS or MD, a lot of my friends say, I don't know if I learned anything. Now I'm actually going to learn when I deal with patients. So the idea of AI being there, emphasizing what, where, what is not being learned, customizing that, whether it's for doctors, whether it's for caregivers. You made a very amazing point of customization that's very, very relevant to learning for caregivers, learning for doctors, learning for even policymakers what is happening, right? So that's a great point. That's intuitive and practical. Now let's move on to Kanak. Kanak, how might these platforms reach someone in general public, say in a region like Middle East, which presents its own unique challenges?
Yeah. So for the public, these platforms can offer gamified quizzes or short videos tailored to the user's knowledge level. And for example, in the Middle East, someone in Jordan might take a Parkinson's risk quiz, and the platform adjusts follow up content based on their answers, making it feel like a conversation. And this approach keeps it accessible and relevant across diverse settings.
Well, speaking of Middle East, let's pivot to regions' unique challenges: limited healthcare access, cultural stigmas. When we come to India, we'll again discuss cultural stigmas, language barriers, which are again very relevant to a lot of countries of Africa, Asia, and even to some extent in South America with tribal groups. So let's go back to Brooks. Brooks, how can AI bridge these gaps, with healthcare access, cultural stigmas, and language barriers?
Yeah, well, the Middle East offers a ton of diversity, and this really demands tailored solutions. AI can deliver multilingual tools, for instance, chatbots in Arabic, Persian, or Hebrew, and these can make information much more accessible. It can also respect cultural norms, addressing stigmas around cognitive decline, which some communities view as shameful. By offering private, sensitive education via apps or websites, the AI can help people learn without fear or judgment. It really helps build trust and it meets people where they are.
Well, that's absolutely amazing, Brooks, because you're bringing back to the point that Malika had said about humanizing of AI. Is genuinely humanizing it beyond what a single human is capable of. It's like taking on a whole village to build a solution. So this cultural sensitivity is crucial. Malika, can you share specific examples of how AI might tackle stigma in the region?
Right. Yeah, yeah. Since you're talking about the Middle Eastern community specifically in this podcast, Alzheimer's is dismissed as just aging or tied to spiritual beliefs, therefore delaying diagnosis in many cases. An AI chatbot could perhaps counter this by explaining the Alzheimer's as a real medical condition using relatable analogies like changes being like something like a car needing a tune up. It could share local stories of families who have sought early treatment and thrived, thus making the message resonate and encouraging action in similar other cases.
Well, that storytelling that you mentioned is very powerful. Malika, are there ongoing projects in Middle East showing AI in action?
Right. There are some reports of exciting progress. In the UAE, Khalifa University researchers are in fact using AI to analyze genetic data from Emirati populations, thus identifying genetic Alzheimer's risk factors which are specific to the region. Saudi Arabia's Ministry of Health is also piloting an AI driven telemedicine platforms which connect rural patients with neurologists and include educational modules on Parkinson's. And in Qatar, AI apps are translating complex medical terms into Arabic, which is important, because there's language variation, right? So making knowledge more accessible.
Yeah, these are very great points. These are very inspiring examples. Dr. Kaniz, now, so Kaniz, what challenges are holding back further progress? How can AI help?
I think the digital divide is a big hurdle. Like we know in rural or remote area, there is a lack of reliable internet or smartphone. So there AI can address this with low bandwidth tools like text-based chat box for basic phone, just like Dr. Malika just said. Another issue is data scarcity, where we need more regional health data to train AI model. Furthermore, this another concept is there, federated learning, where there are certain countries like Lebanon and Oman that share data securely. So their federated learning can build inclusive AI tools that reflects the regional diversity.
Well, that's a great point. Federating learning is something actually is one of my current interests, even how to build better models. It's a very interesting concept for some of the people who are not from AI. What happens is you are keeping the data where it is. The model is learning without taking the data elsewhere. So let's say if you want to do clinical trials in, let's say, an Arab country or India, but we don't want the identities to be revealed. We want to respect this privacy, or let's say in Europe with GDPR and all those various new compliances. We make sure that the data stays where it is, but you can train AI models. So data, federated learning is a very fascinating concept. Sohit, can you explain it simply for our learners, for our listeners? I have tried to do it, but I think you can do a better job than me.
Yeah, sure, Dr. Sukant. Like it's like hospitals in Dubai, Riyadh, and Beirut training a shared AI model like without moving their patient data. Each hospital's data stays local, but the AI learns from all of them, creating a very smarter tool. Think of it as a team project where everyone contributes from their own desk.
Great analogy. I couldn't have done it so well. Kanak, how does sort of predictive analytics and early detection tie back to education in the Middle East?
Yeah, so predictive analytics uses this AI to analyze data sets like in genetics and lifestyle to identify at-risk groups. Like in the case of Middle East, where family health history might be undocumented, AI can use public health data to spot patterns. And this powers targeted education, like a Kuwaiti campaign linking diabetes to Alzheimer's risk, given the region's high diabetes rates. And the early detection tools like AI analyzed brain scans show the value of early checks. It can boost the awareness also.
That localization is key. Brooks, what ethical pitfalls should we avoid as we roll out these AI tools globally and in the Middle East?
Well, we could do multiple episodes on ethics alone in AI, and maybe we should. Ethics is obviously paramount. Privacy is incredibly important. Health data shared with chatbots needs robust encryption and clear consent. Access is another huge concern. The tools must be affordable and work on basic devices that can reach rural Yemen or Iraq. Cultural sensitivity matters a lot as well. Content should respect family oriented values, avoid overly clinical tones. And you also need to be really cognizant about accuracy. All AI information must be vetted by experts to avoid myths or false hope, and this helps to ensure trust.
Well, these are vital considerations. Malika, how do we balance cultural sensitivity with universal evidence-based information?
Yeah, I think the term universal is interesting because we were just talking about data exchange and data security and etc. So of course the science is important, but it's just not the science. It's also about adapting the delivery. So as we said and discussed and understand, Alzheimer's biology is universal. But in Egypt, AI might use family caregiving metaphors to explain it, resonating locally with the local population. And AI can analyze regional social media trends to put in or tweak tones or examples, thus ensuring that the message feels relevant in the Egyptian context while also staying grounded in the evidence. So it's basically a balance.
Yeah, that's a very smart balance. Malika, let's dream big. What's your vision for AI and neurodegeneration awareness, especially in the Middle East?
I think certainly it's a very challenging, demanding, but a very interesting and required and a shared mission, more importantly. Globally, it empowers with early detection, education, and communities. And in the Middle East, it has to break and will break barriers, I hope. Multilingual chatbots reaching remote areas, as an example, campaigns challenging stigma, and partnerships that bring AI to the region. Just picture a farmer in Oman using an app to learn about Parkinson's risk, or even a Syrian family joining an Arabic support group. So, with collaboration, local innovators, including global researchers, policymakers, brain health together can become a priority, ranging from Dubai and to places like Damascus.
Well, that's very inspiring, Dr. Mallika. Kanis, any final thoughts on this vision?
Yeah, I think it's about empowerment. AI can make complex science accessible, giving people tool to act early and live better, especially in underserved region like Middle East.
Well said. Sohit, what are your closing remarks?
I would say just that AI's potential is huge. It's about making it inclusive and actionable for everyone.
Kanak, what do you have to say to conclude?
Yes, agreed to this, and it's an exciting time to see technology and compassion come together.
Okay, absolutely. We have Sahil, Aditya, Jinyasa listening in. Let's talk to them. Sahil, what do you want to add to this whole discussion?
Yeah, I didn't know AI could make learning about brain diseases fun, like using games and quizzes. That really stuck with me.
Well, that's good. Aditya, what about you?
The early detection part blew my mind. It's like AI helps catch things before even symptoms show up.
Jinyasa, what about you? I like the analogy Aditya and Jinyasa basically have said about like how they have learned. What do you think of it?
Yeah, I liked hearing about AI helping families in the Middle East learn in their own language. It's like giving everyone a chance to keep their brains healthy.
That's really good. Wonderful insights, all of you. And I really liked the very interesting angle of AI humanizing things. Thank you for this vibrant discussion, everyone. That's all for today's episode, folks. Stay tuned for more insights into the fascinating world of neurodegeneration and AI. Keep listening, subscribe to us, and thank you once again. Bye bye.
Thank you.